Hello guys, how are you all? Hoping you are all good. Okay, so I am coming with next video, next important topic for your NEET MDS. So stay tuned. Okay, so next important topic for your NEET MDS, general anatomy is embryology. In embryology, mainly the pharyngeal arch system is very important topic for your NEET MDS. Okay, every year many questions are asked from this topic. So please connect with me and stay tuned. Okay, so starting with pharyngeal arch system. So firstly we know about some basic embryonic starts. So first of all, in first and second week there is formation of zygote. The third to 8 week there is embryological period. Okay, in third week there is a cardiovascular system is visible. Okay, cardiovascular system किसमें भी तो third week visible and fourth week stomatidium appears. Stomatidium is primitive mouth separated from primitive pharynx by buccopharyngeal membrane. ठीक है, that is oropharyngeal membrane. These membrane rupture at about 24 day. Okay, main purpose of my telling about this basic is mainly the fourth week, in which the fourth week brachial arches develop. Okay, in fourth week brachial arches develop as neural crest cells migrate to the future head and neck region. Okay, by the end of fourth week 4 pairs of brachial arches are visible, fifth sixth are small. Okay, brachial arch are being separated by brachial grooves and a number in craniocaudal sequence. Okay, let me show the diagram. These brachial arch 1 2 3 4 numbering given. This is the pharyngeal arches which develop. Okay, this is the primitive mouth buccopharyngeal membrane which separate this from mouth, but this rupture at 24 day. Okay, mesenchyme in the arches give rise to muscles. ठीक है, mesenchyme in the arches होंगे. Mainly this is pharyngeal arches ectodermal, but intervening in between them there is a mesenchyme from which muscle derived. Okay, neural crest cells migrate into the arches, creating the swelling in the arches and contributed to the arches. ठीक है, from each pharyngeal arch there is a structure develops. One is a nerve, one artery, one skeletal elements and muscles. 4 components develop from one arch. Okay, so let's begin with it. Okay, this is the head bulge, this is head bulge, this is heart bulge. Okay, this is stomatidium and this is pharyngeal arches, and these segments appearing in vertical, this is the somites. Okay, this upper limb and this is lower limb. Okay, this is tail. Okay, caudal axis. Okay, this is cranial. Okay, now next talk about pharyngeal arches. Okay, first of all we just should know about the what is ectodermal lining, endodermal and mesodermal. Okay, first, how many are there, ectodermal and endodermal? There is a pharyngeal arches, there is 6 pharyngeal arches, first, second, third and fourth, fifth, sixth. Fifth disappear and so their persistent is 5 pharyngeal arches are there. So we discuss about detail in 5 pharyngeal arches, first, second, third, fourth and sixth. Fifth will disappear. Okay, would disappear. Okay, next is the these outer layer is the ectodermal derive. out outer layer, outer, this outer layer is ectodermal, this is the ectodermal, and inner is the endodermal. Okay, and intervening in between is mesodermal, and this is the buccopharyngeal membrane, this is the stomatodium, mouth opening. This membrane rupture and will at 24 day and will connect with the amniotic filled cavity. This is the maxillary prominence. Okay, mainly we talk about pharyngeal arches. Okay, this whole is the pharyngeal arch from which their derivatives derived. Okay, so let's talk about firstly about the pharyngeal arches. Okay, starting with first pharyngeal arch. First pharyngeal arch is mandibular arch. Okay, mandibular arch. What artery is derived from it is maxillary artery. Cranial nerve fifth trigeminal. Trigeminal कौन सी? Mandibular division mainly. Mandibular division of trigeminal nerve is first arch derivative. That's why its name is mandibular. Okay, skeletal is the Meckel's cartilage. Meckel's cartilage derived from Meckel से क्या क्या बनता है? Incus malleus. Okay, maxilla. Some part of maxilla derived from first arch. Some part of mandible. Okay, arrived from this. Mainly, how do you remember five M's? Okay, how do you remember 5 M's? M first is the malleus incus first, second maxilla, third mandible. Okay, and fourth the Meckel cartilage. Okay, this is the 5 derivatives. Okay, next is a muscles. How do you remember muscle of mastication? You know trigeminal nerve supply muscle of mastication, so it include muscle of mastication, anterior belly of digastric, anterior belly of digastric, you note it down, anterior belly of digastric, and tensor tympani and tensor belli palatini. Okay, these muscles are derived. How you remember it? M A T 2. M is mylohyoid. M is mylohyoid muscle and muscle of mastication. Muscle of mastication include first temporalis masseter, pterygoid, lateral pterygoid and medial pterygoid. 4 muscles are muscle of mastication. Then is mylohyoid muscle. सेकेंड ए से क्या होएगा? एंटीरियर बैली ऑफ डाइगेस्ट्रिक, जो सप्लाई कौन करता है? मैंडिबुलर ब्रांच कर दी है ना ट्राइजेमिनल की. एंड T2 कौन होंगे? टेंसर वैली पैलेटनी एंड टेंसर टिम्पैनी. सो हाउ दिस इज द निमोनिक फॉर रिमेंबरिंग द मसल ऑफ मसल्स ऑफ डेरिवेटिव्स ऑफ फर्स्ट आर्च. क्लियर? आर्टरी कौन सी है? मैक्सिलरी आर्टरी. नर्व मैंडिबुलर डिवीजन ऑफ ट्राइजेमिनल नर्व. स्केलेटल डेरिवेटिव्स कौन? मैक्कल कार्टिलेज, मैक्सिला, मैंडिबल, जाइगोमैटिक. मैक्कल से क्या डेराइव होता है? इनकस एंड मैलियस. के मसल से मसल ऑफ मैस्टिकेशन MAT2. M से क्या होएगा? माइलोहाइड. A से एंटीरियर वैली ऑफ डाइगेस्ट्रिक. T2 यानी कि टेंसर वैली पैलेटनी एंड टेंसर टिम्पैनी. ठीक है, दिस इज द मेन. And I will show you some things also. This is the image. Muscle of mastication, muscle list, ठीक है, and mandibular nerve third division होती है. Okay. Next is the pharyngeal arch number 2. Pharyngeal arch number 2 से कौन derived the muscle of, इसका नेम क्या है? हायोइड. सेकेंड आर्च का नेम. ठीक है, आर्च ऑफ आर्टरी क्या है? स्टेपिडियस आर्टरी. Stapedius artery in embryological period and adult corti tympanic artery. ठीक है. Cranial nerve derived from this facial nerve. Facial nerve कौन सी nerve होती है? सेवंथ nerve. ठीक है. Skeletal element derived from it is mnemonic for this is 5S. I tell it. Stapes, styloid. Please write it down. Stapes, styloid process. Stapes क्या है? Bone of ear. ठीक है. Stapes, styloid process, stylohyoid ligament, smaller cornea of hyoid bone, upper body of hyoid bone. Okay. 1, 2, 3, 4. Okay. 5. Lower portion of external ear. ठीक है. एक्सटर्नल एलिमेंट ये हो गया स्केलेटल एलिमेंट. स्केलेटल एलिमेंट 5S. So easy to remember. Learn it. Next is the muscles. Muscles of face. Muscles क्या डिराइव होती हैं सेकेंड आर्ट से? तो हम देखो फेशियल नर्व है. फेशियल नर्व से फेशियल नर्व क्या क्या सप्लाई करती है? मसल ऑफ फेशियल एक्सप्रेशन. But they supply muscle of facial expression. All the muscle of face, facial expression are supplied by facial nerve. So derivative कौन होंगे इसके? Muscle of facial expression. Okay. Orbicularis oculi, orbicularis oris, auricularis, platysma, frontalis, buccinator, and 3 main SPF, sun protecting factor. Okay. सन प्रोटेक्टिंग फैक्टर डिमोनिक. एस से क्या होएगा? डिराइव करती है इससे स्टेपिडियस. ठीक है. स्टेपिडियस आर्टरी. स्टेपिडियस मसल एंड स्टाइलोहाइड मसल. स्टेपिडियस मसल एंड स्टाइलोहाइड मसल. ओके. प्रोटेक्टिंग पी से पीस निमोनिक. पोस्टीरियर बैली ऑफ डाइगेस्ट्रिक. एंटीरियर बैली ऑफ डाइगेस्ट्रिक सप्लाइड बाय ट्राइजेमिनल मैंडिबुलर डिवीजन ऑफ ट्राइजेमिनल एंड पोस्टीरियर बैली ऑफ डाइगेस्ट्रिक सप्लाइड बाय फेशियल नर्व. और इसकी किसके डेरिवेटिव है? ये सेकेंड फेरेंजियल आर्च की. एंड फैक्टर एफ से क्या होएगा? फेशियल एक्सप्रेशन. मसल्स ऑफ फेशियल एक्सप्रेशन. तो ये अब निमोनिक इसका याद करने का SPF. ठीक है. SPF सन प्रोटेक्टिंग फैक्टर. तो ऐसे हो गया हमारी स्टाइलोइड और स्टेपिडियस, पोस्टीरियर बैली ऑफ डाइगेस्ट्रिक, और F से होगी फेशियल एक्सप्रेशन की मसल्स. ठीक है. 5S से होगी हमारी स्केलेटल एलिमेंट और उसकी थी 5M फेशियल नर्व और आर्टरी क्या है? स्टेपिडियस आर्टरी. क्लियर. नेक्स्ट इज द थर्ड फेरेंजियल आर्च. ओके. third arch of artery derived from it is common carotid artery, mostly internal carotid. ठीक है. common carotid artery from proximal portion common carotid artery and distal portion internal carotid artery. There is mistake in writing there. No, stapedius artery is not derived from it. Derived is common carotid artery and internal carotid artery. ठीक है. Write down. Cranial nerve derivative is glossopharyngeal nerve. This is also wrong. Glossopharyngeal nerve, ninth nerve is derived from it. ठीक है. One minute.